I'd like to welcome everybody to today's webinar, which is part of our Improving Ohio's Health webinar series. Today's webinar is Making Your Patient's Care Plan Come Alive, Electronically Connecting the Community. My name is Scott Mesh. I'll serve as host for today. I'm joined by Karen Bishop and Dottie Howe from CliniSync, John Leite from the Health Collaborative of Greater Columbus, and Steve Thompson from Healthy Hands and Wellness Center. With that, I will turn it over to Ms. Dottie.
Well, thank everyone this morning for joining us. Today's focus for the Ohio Department of Health will be on the community, and some of the answers, the questions that we'll be answering will be, what is the Ohio Health Information Partnership and CliniSync? What's a medical neighborhood? How does Helping Hands Health and Wellness Center use their referral tool to improve care? How do CliniSync's tools electronically connect providers and other entities, and how does this benefit the community? And finally, how does accurate, more comprehensive data help with care plans?
You know, Dottie, I'm sorry, I hate to interrupt. I forgot to mention that the handouts are available. You can download those through the GoToWebinar handouts feature. Also, if you do have a question, we ask that you enter your question into the question box or into the chat feature of GoToWebinar, and then we'll answer all those questions at the end. I'm sorry to interrupt, Dottie.
That's
so
okay.
Back to you.
Okay, great. Scott, you can go next one. So I wanted to give you a little background. I know we don't do a lot of marketing or advertising, but we are the Ohio Health Information Partnership. We were formed in 2009 with federal funds. We helped 6,000 primary care physicians adopt electronic health records, and we created a statewide health information exchange. Our founders are the very people who represent the medical community, the Ohio Hospital Association, Ohio Osteopathic Association, Ohio State Medical Association. We also received some funding from the Department of Insurance. We are governed by a board of directors who also are representatives of physicians, hospitals, health plans, HIT, long-term care, and consumer groups. In the past 2 years, we formed a CliniSync Advisory Council that helps with the operations of the CliniSync Health Information Exchange, because these are the people that are using our exchange. So we today are happily financially sustainable without any kind of outside funding. And just to give you if you look around the circle, hospitals, physicians, these are all of the people who are involved in the CliniSync community. No one is left behind. And as you can see to the left bottom, allied healthcare is our term for those who are not part of the medical community, but maybe social service agencies and other ones involved in taking care of patients in different ways. We have 148 hospitals that are contracted. 123 are live right now. 6,000 clinicians and physicians are on board. We can't estimate the number that are hospital employed, so it's much higher than that. 2,000 are using what we're calling our community health record, and we'll explain what that is. There are 15,000 direct emails, that's a secure messaging system, and we have 400 long-term and post-acute care facilities involved. And essentially, connecting the medical neighborhood is a concept that comes from patient-centered medical homes, where the patient is the center of the universe, and all those around are helping to coordinate the care. That is, of course, the ideal, and the medical neighborhood concept stems from that. Next slide. And so what is the medical neighborhood? Well, thankfully, we've got John Leite. He's a healthcare improving consultant with the Healthcare Collaborative of Greater Columbus. Some of you may know that formerly as Access Health Columbus. They really started out with PCMH emphasis and have broadened. And so, John, why don't you tell us a little bit about the medical neighborhood?
Thank you, Dottie. And just some background on my organization. As Dottie mentioned, we were Access Health Columbus up until a few years ago, and our focus was really on expanding the PCMH model here in Central Ohio. So we worked with providers for a few years to really implement and then maintain recognition as PCMHs. And as that work has developed, we've really shifted our focus to helping expand the medical neighborhood in town. And so what I mean by that is really connecting those patient-centered medical homes to social service agencies, hospital systems, medical specialists, social service agencies, really anyone that can play a role in a person's health, because we do realize that although it's important to help primary care providers operate as PCMHs, it also is going to take more than that to really truly get to improved outcomes for a patient. So, when you're seeing a patient for an hour or a year potentially, are you really going to be able to impact their diabetes if they don't have access to things like healthy foods, or if they're homeless, are they really going to be worried about their A1C? And so the goal behind the medical neighborhood is really to connect in all these auxiliary services that could impact a person's health and really lead to improved outcomes for a patient. And you do that by implementing technologies and other things to really improve the referrals throughout this network, but also lead to higher or better quality care coordination. And so about 2 years ago, when we started to make this shift into the medical neighborhood, we brought together a group of organizations to really learn about how they were currently making referrals, the challenges that they were faced with in making those referrals, and then eventually hopefully lead to some solutions to those challenges. And what we really heard is what you see on this slide right here. So faxes, emails, phone calls. If you make a referral, it may be difficult to know if you'll ever receive a response back around that referral. If you do receive a response back, it might be in a way that doesn't align with the workflow you've set up to handle referrals. What we also heard from these organizations is that it can be very difficult to know what services are available in the community to help their patients. And so oftentimes you spend time, just searching through service databases or making phone calls to other organizations just to figure out what it is that they even do. And so obviously this leads to a lot of inefficiencies, a lot of time spent focused on a referral rather than helping a client improve their condition. So next slide. So what that group really suggested that could be a potential solution to that problem would be by implementing this concept of a shared referral infrastructure. And so what I mean by that is really a web-based tool that allows you to make these referrals in real time. And so on one hand, those can be kind of really complex tools that could really serve as a provider's EMR or a social services client database. Sometimes they can do things like track an organization's capacity in real time, so do appointment scheduling, all those things. But on the other hand, they can really just strictly focus on referrals and make that process standardized and really efficient across the whole community. And so we brought together a group of organizations to help us really design a project because we felt there was a need to really start to implement this across the medical neighborhood in town. And what that design team, their purpose was to identify the functionality that they felt would be necessary for one of these tools, but then also use that functionality to pick a tool that they felt kind of best met the needs for our community. And what they came up with was the CliniSync tool they felt really best met our needs. And for a number of reasons, and I'll let Steve really go into the details on what the tool does, or Karen let it go into the details on what the tool does and kind of how it can be used. But really the reason why that design team felt CliniSync best met our needs was, one, it's strictly focused on referrals for our purposes, and so it wasn't going to try to replace providers' electronic medical record or do a lot of fancy things like track capacity and really lead to more work for some of those organizations. It was really going to just fill the niche of referrals throughout the medical neighborhood that wasn't already available in our community. The second reason was that it's offered by an organization that's actually located here in Central Ohio, which makes things very easy when there are issues with technology or we're having challenges with training and things like that. It's very, very simple to kind of get those things worked out with an organization in town. And then the last reason was that it was offered at no cost to social service agencies and independent providers. So obviously that was a huge selling point as far as the referral tool goes for especially the social services who typically operate on kind of thin margins. And so that was really the reason why they picked it. They also liked the functionality of the tool itself, which I know we'll see a little bit more about here in a minute. But now that we're out really expanding this network in town, we do have a number of organizations that are now actively exchanging referrals on this tool. And so the first slide here that you'll see is the provider organizations in town that are actively exchanging referrals. And you'll notice that we have a hospital system, a big independent provider group, a couple of FQHCs, behavioral health organization, and then also a free clinic that we'll actually be hearing more about here in a bit. And then on the second slide here, this is all the social service organizations that are actively exchanging referrals. And one important note about these organizations is that we made the decision in town to start with all covered entities. And so all of these social services, either the organization or the service that they're including has been considered a covered entity under the guidelines of HIPAA. And so they have protocols in place to protect patient information. They have basically all the guidelines in place to say that we have a reason to access patient health information. And we felt that that was a good place to start because we wanted to make sure we were rolling this out in a way that, one, protected the providers that were going to be involved, but also thinking through who really needed to have access to some of this information that was being exchanged in the CliniSync system. But with that being said, we're working with CliniSync to figure out ways to really bring on additional organizations as well. So a good example would be food pantries, who certainly could play a role in a person's health, but really don't have any reason to become a covered entity. We want to bring those into this network at some point, but we want to do that in a way that really continues to protect the providers and other organizations that are involved in this, as well as the patients and their health information. And so the last slide here just lists the organizations that have committed to participate with this project, but are still working through the implementation and training process. So we hope to have these organizations live in the coming weeks and months. But as you can see, a pretty diverse group of organizations that are involved at this point. So with that, I'm going to turn it over to Karen, or Dottie, or back to Dottie.
So we had the opportunity, I had the opportunity as a writer and communications director to actually go to visit Helping Hands Health and Wellness Center. And if you go to the next slide, you're going to be talking briefly with Steve Thompson, who's the Director of Administration for Helping Hands. And I'd just like to give you a little bit of the background. It is a 9-year-old faith-based nonprofit. It really lives by private and church donations with an operating budget of only $130,000 annually. It's located on Morse Road in Columbus, and they rent space from Ascension Lutheran Church. And there they set up what are kind of like a Rubik's Cube of little places that a patient goes to see the lab, to see the doctor, to see a consultant, and so forth. They care for 1,200 patients per year. Primarily, it's adults 18 and over. Patients are eligible if they meet 200% of the federal poverty guidelines. So we're talking about the fringe of society that does not get the health care that many of us have. So it's the indigent, immigrants, refugees, the uninsured, the underinsured, and Medicare and Medicaid patients who may be in line to receive care but have not yet received it. So they have free clinics 4 times a month on Thursday and Friday starting at 2:30 p.m. And it's quite an amazing it's an amazing service that they're doing because they only have 1 full-time and 3 part-time staff. Everyone else is a volunteer. They use OSU pharmaceutical students. They have consultants. They have doctors come in to volunteer, nurses. It's an amazing operation. And it ranges everything from basic medical care to, of course, what we're talking about today, which is hypertension and diabetes screening, and then the patient education for that. Chiropractic, lab work. They have a navigator on site who will help the patient go through the insurance, navigate through the insurance field, whether it's Medicare, Medicaid, or the marketplace. They have prescription medications that they fill through a pharmacy, and all kinds of social services, spiritual guidance, specialists. They refer to vision and dental clinicians, and they also have connection with the Ohio Benefit Bank Services. They do work and school physicals, and they do TB testing. And I just want to tell you quickly what referrals are. If you take a look at this graphic, you'll see that on the left here is a provider, could be Steve's operation, and they are going to go over here and send a message to another provider and say, I'm referring this patient. And they may have questions, they may have attachments they need to put, whatever is required by that organization. And then the cool thing is that then it tracks the activity so that the original person who has started the referral knows whether or not the person ended up at a visit, has a scheduled appointment, if there's further follow-up. That's the ideal. We hope it would work that way for everybody, and that's our goal. So if you move to the next one, you'll see there's Helping Hands Health and Wellness Center. They work with Charitable Pharmacy. They send over, the doctors send over, or their pharmacy students send over the prescription. Charitable Pharmacy fills it. And a lot more goes on in there than I can show here, but we will be showing you an article that we're writing about it that goes into more depth. So with that, I'd like to introduce Steve and have him help us go right through the referral tool.
Thank you very much. My name is Steve Thompson. I'm the Director of Administration at Helping Hands Health and Wellness Center. And first of all, I want to thank everybody for allowing me to be here today and giving me the ability to talk about our free clinic and how we use the CliniSync referral tool. This first slide that we have is a screenshot of our EMR system. And if you notice, this is a patient's visit screen that you're looking at. Of the 6 boxes here in the middle of the screen, the lower right-hand box talks about referrals. These are the referral agencies that we deal with on a daily basis. And if you notice that we've checkmarked for this particular patient, we've checkmarked Charitable Pharmacy of Central Ohio. So we're going to use this as an example as to how we go through the CliniSync referral tool. Next slide. This next screen now is we're starting the process to go through the CliniSync. So we've logged into CliniSync, and what we're doing here is we're starting to enter the patient's name in the search field to see if the patient is currently in the system. So next screen. After that, then the system can't find the patient, which means that we have to start the new patient record. Next screen. Now we go and start adding the patient's information to the medical neighborhood system, and then we click Add Patient. We start the referral process. This is a screen showing our current referrals that we have in the system. Obviously, we've blanked out the patient's names for HIPAA requirements, but we did want to show what that screen looks like. Now we're ready to create the referral. Okay, so we start the process to create the referral. Yeah. And we start entering the patient's name into the system, last name, first name, address, city, state, zip, all of the demographic information that the system requires. And if the system does find a match based on the address, then it'll let us know. But in this case, in this particular case, there is no information, so we're starting the new patient chart. This next screen shows us that we're ready to start the referral. And if you notice on the box to the left at the bottom, there's a referrals area. We click on that, and then we start the referral process. Okay, so if you notice in the next slide, way over to the right-hand side, third box down, there's the Create Referral button. So we click on that, and that actually starts the referral process. Okay, so we have the patient identified who we're doing the referral for, and I wanted to note that we are starting to fill in the drop-down boxes. We have the medical neighborhood box that we've selected, the charitable pharmacy box, and then the organization, practice, and location. We've selected charitable pharmacy again. Next slide. Now we're starting to enter the referral reason. So in this case, the patient needs help with medications that we've written prescriptions for, and we're asking for them to see the patient the next week. Next slide. Okay. This is the bottom of the same screen of the referral process. And then we click Next to continue. We start answering questions about the patient, as far as are they a resident of Franklin County, what their estimated monthly income is, those types of questions. And then the next slide is at the bottom of the same screen, and we're answering more questions about the patient. Notice that we've put in the physician's name and the physician's telephone number if there's any questions. And then we click next to continue. Then if there's any attachments, any files that we need to upload into CliniSync, we would do that here. In this case, we do not. We ask the patients to take their prescriptions to the charitable pharmacy when they go for their appointment. The next screen is we verify that all the questions are answered, and if there's anything that pops out in red, then that means that we either haven't answered the question or we've answered it incorrectly. So we go back, correct those, and then we click Refer Patient. Okay, we are now successful. We've created the referral for charitable pharmacy, and now the charitable pharmacy can help the patient with medication. This next screen just shows a review of the referral, and I wanted to make everybody note that the status of this particular referral is in the new status. And then this next screen is the referral screen showing that we've just entered in the new referral and how it appears. Note that there's a in that box where we just did the referral, that there's a green triangle up in the upper right hand corner. Everything is color coded. It lets us know whether the patient, whether someone's acted on that referral, or whether this is a brand new referral, which in this case green means it's a brand new referral. Nothing has happened on it yet. This last screen takes us back to our EMR system, and this is the referral screen that we have. And if you note in the notes section of the screen, we have the information that the patient referral has been sent through CliniSync. The patient is now in queue with charitable pharmacy to be seen. That's it.
Well, that's great. Thank you so much. And we'll get back to Steve with some questions as we chat and find out what this is, how this has impacted his organization. Now I'd like to introduce Karen Bishop, who is the manager of Health Information Exchange Connectivity and Exchange Solutions. She's going to go through the services that we can offer you as a practice or other entity. And there's a lot of info on these, but she's not going to read it all to you. She's going to leave it up to you to read some of it. She's just going to go over it quickly.
Yes, thank you, Dottie. Okay, so we do have 6 service lines. So first we're going to talk about our connect and integrate our free service packages. In the community health record, of course, Steve and John have both talked a bit about that. Basically what that is that's your access to single community record. And within that portal is also that referrals tool. Now I will touch a little bit on direct messaging when we get a little further into the slides here, just to share a bit more about that. Okay, so again, here is the community health record, and I would ask that you review the scenarios that Dottie has put together for us. It will help you better understand the product and maybe how it will best work for your practice or organization. Okay, so again, as we say, it's that single point of access. You might wonder, well, how does that information get in there? So when Dottie began speaking about our products and about those 148 hospitals who are contracted with us, which 123 are currently live. So those hospitals are sending us real-time data. So they're sending us ADTs, which would be that admission, discharge, transfer data about those patients to populate that community health record, as well as the lab results and radiology results and things like that within the community health record. So that may give you a little better idea of what you would expect to see in there. Okay. The next service under would be the results and report delivery. So something that a good use case here may be that you see a patient for hypertension or diabetes, and you ask them to go get some blood work done. So they have that blood work done at the local hospital. So that blood work, upon resulting, will flow through into your EHR. In the case of perhaps a diabetic patient, that A1C level can be mapped or flow charted within your EHR. So that's just one scenario of how you might want to use that. Now, if you don't have an EHR system, we do have other tools that you can use as well to get those results and reports into your office readily. Okay, and then, of course, for the referrals option that Steve and John have talked about, just ways that you can securely communicate. It kind of closes that loop on referrals. We just ask if you have another partner there in the community, and maybe you do a lot of phone referrals today, that's a good use case and a good first step into using the referrals application. You can start slow and kind of move forward, if you will. And for the direct messaging piece, so if you have an EHR, you probably have direct messaging within your EHR. If you do not, you might need direct messaging, especially for provider-based practices. It is a free solution that we can provide to you. It works very much like web email. However, it is a different platform. It is secure and encrypted, and also any of the addressees have been verified and vetted. So that way you know if you're sending to Dr. Smith that you are getting Dr. Smith. So that's kind of some of the things that makes it a little different. So two of the other service lines that I'll kind of highlight here a bit is Contribute and Notify. So Notify is basically a system that looks at activity that flows from the hospitals. You would give us a patient panel, and when it found a match to your patient panel for that activity, it can automatically alert you to the fact that your patient has perhaps been into the hospital or been to the ED, or perhaps they've been discharged to the hospital, so you don't need to go round on Monday morning. So really it can be however it best works for your facility or organization. So that's kind of how we design the alerts that can come to you in real time. We can deliver those in a manner of ways from just a general email that has no PHI to just let you know you have an alert, down to a portal where you can actually see why your patient had been admitted, and then that way you were able to follow up with them rather quickly. So under the Contribute, the easiest way to kind of describe what Contribute is being a continuity of care document created out of an electronic health record and published to the community health record. So that's probably it probably sounds like a lot of stuff out there that I just said really quickly.
It is.
So there may be times when a patient has been referred to a specialist. So we'll say that they need a surgery intervention. So the surgeon sees your patient, they do the surgery, and they've documented that all in their community health in their electronic health record, excuse me. So what they could do is they could contribute that up to CliniSync. So then you, as the treating provider, would be able to go in and pull that down and see the details of how your patient was treated, if there's any ongoing care you need to monitor. So that's kind of, in a nutshell, kind of what Contribute is. The good thing about Contribute is the more data that's contributed from providers, from their practices and organizations, the more robust that community health record is. The better way that we can kind of treat patients as a whole, and all the services that kind of wrap around that patient.
So really Contribute, the intent of Contribute is to build the complete patient story from everybody that patient sees, if everybody were to contribute, any provider that sat down, received that patient would know exactly the entire history and what's going on.
Absolutely. Absolutely. Thanks, Scott, for wrapping that up better. Okay. So I know that we just kind of blew through some of these items today about the services because we do want you to be able to kind of think about these a little bit, maybe think how they would work in your area, in your organization or facility. We do have 5 community outreach managers that work across the state. Their contact information is here, or of course you can always call any of us also whose information is available in the slide deck today as well. So one other thing that I would like to chat about is the pharmacy project with Kroger and within the Columbus division. So they're going to be participating with the medical neighborhood and also with the hypertension and diabetes patient management. So within the Columbus division, there are 120 pharmacies that are planning to participate. Majority of those from Central Ohio. However, in this division, there is one in Michigan and a half a dozen in West Virginia. So some of the services that they'll be offering to support disease management will be that free healthy grocery tour, tobacco cessation coaching, I always have trouble saying that, and of course immunization services and travel vaccine consultations as well, just to really, again, work in caring for the patient as a whole. We are in the early planning phases of this project. As you can imagine, it's a rather large build, and we're very excited here at CliniSync to be working with Kroger on their KTV. They're actually going to be producing our training videos to share with their pharmacy managers. So we're really excited about that. Okay. And now I'm going to turn it back over to Scott.
Thank you, Karen.
Thank you.
The intent of today's webinar was really to show how one organization that deals with particularly difficult patient base to manage, especially with respect to hypertension and diabetes, uses not only their EHR but some supplemental tools that are available to ensure that the patients receive the best care possible, and they provide them with the tools necessary to manage hypertension and diabetes. I would like to remind you that we do have several webinars scheduled in this series. Next one will be Tuesday, August 16th. This is the impact of some new regulations on chronic care and transitional care management. And then August 23rd, we have a webinar that's using technology to support your patients with chronic care conditions. It doesn't have to be painful. We're going to be looking at some of the tools available within EHRs and outside of the EHR that many organizations are leveraging right now for their chronic care management programs. So now we are going to open it up to questions. So just give me a second here to pull things up. Question number 1. Do you have to create the patient record if you have never referred them via CliniSync before, but other entities have?
Good question.
Yeah, that is a great question, and it would be no. The answer is no. As long as the patient has previously been included into statewide master patient index, you'll be able to search for that patient and then create the referral from that record.
So Karen, just tell them the master patient index is the community health record information that has come thus far from hospitals. So go ahead.
Correct. Yes. So the majority have come from hospitals. We also have some practices that are contributing ADT. And then, of course, everyone within the medical neighborhood. If that patient was not previously in the master patient index, they are adding them. And then that is included as a record within the community health record.
And that patient information is from the time that the hospital has gone live. Karen, it's not like 10 years ago.
That's correct.
It's only going to be when that hospital comes live. And on our website, there is a place where you can go under members to see who our members are.
Absolutely.
Okay, the next question. Our EMR has the ability to send a referral to an outside provider's direct message email address. The EMR allows us to include a CCD and anything else we want from the chart. What's the benefit of the CliniSync referral tool over this method for referrals to physicians particularly?
It's disparate systems. Go ahead.
Yeah. So that's another great question. So what basically is the benefit? When you send in CliniSync, you're going to be able to see the activities that the receiving office is taking. So have they accepted the referral? Have they scheduled the patient? Have they included a consult back and closed that referral? So there's various methods that someone works a referral that you have sent to them to let you know what's going on. It's not really just sending it out and hoping that the patient follows up or the practice receives that and what have you.
So you get the benefit of kind of an ongoing status update and also including organizations that don't normally have a direct address outside of what folks may consider traditional healthcare.
Absolutely. And that way, too, you can give a reason for that referral other than just sending a CCD.
All right, we're going to leave the microphone right where it is, Karen, because you're probably best suited to answer the next question. If I refer patients to the transplant centers at UH or Cleveland Clinic, how do I do that if they are not listed as one of your referral entities today?
Another great question. So what we would do is if there is a need out there and the hospital or facility is not participating today, then we would reach out to them, let them know what scenarios exist out there, and bring them on board.
Next question is, what's the name and contact of the presenter of the suite of services for all of the Ohio presenting right now? That would be Karen Bishop, but if you contact anybody on this slide with an ohiponline.org email address, we will get you the information and get you in contact with the right individual. This next question is for Steve, so we're going to move the microphone. You breeze through those screenshots, but in reality, how long does the process take to create and send a referral?
The actual process, once you've logged on to CliniSync, probably takes in the neighborhood of 5 to 8 minutes to start and finish the process.
Okay. John, this question is for you. What's the most difficult problem you are encountering in Central Ohio?
I think the biggest challenge with the project we're having right now is people are picking up the tool pretty easily. I think the challenge we're seeing is really changing culture within these organizations to adopt a new piece of technology into their workflow. And so as folks get up and live on this system, we're having some challenges with people still reverting back to using the faxes, emails, phone calls method, and just helping coach them to say, if you commit to this tool, it's really going to help standardize your process. And for the ones that have committed to it, they are sharing with us that it's a lot more efficient. I mean, to Steve's point, you can do these in a couple of minutes, and we've heard from some organizations that what would usually take them 7 to 10 days to do is taking them a couple of hours to manage an entire referral. So I think the biggest problem has just been changing the workflow and culture of an organization.
The next question is, when will the recording be available? Now, give us a day or two. We'll try to get this uploaded. Generally, usually the day after or by the end of the week, we'll have the slide or the recording uploaded. The slides, again, the slides are available from within the GoToWebinar app. If you click on the handouts, you can download them. We'll also send the slide deck out to all the attendees as well. Then the last question we currently have, let me check one other place real quick. Check the chat box, make sure none got in there. Nope. All right, the last question is, can you explain why ODH folks are included on this slide? And absolutely. This presentation is part of a project that we're working on with the Ohio Department of Health that is funded by 2 different grants from the CDC. The intent of those funds is to focus on hypertension and diabetes across the state with several very focused projects in 7 different counties where they are focusing on everything from community programs for selecting, the proper healthy foods. There's also some pre-diabetes prevention programs that are in 7 different counties. We're also working with some health systems across the state to incorporate some new diabetes guidelines. And of course, our piece is to provide some education, some general education around EHRs and technology that can be leveraged to manage those patients. We can provide, if you would like more information on this project, contact any of us and we'll get you some more information.
Scott, could I ask one more question of Steve? Since I got to go out there and watch it all in action. Two questions. One is, how has it helped your free clinic thus far, this referral tool? And if you had a perfect world, what would you be able to do? And who would you be able to work with?
Well, the answer to the first question is that it greatly streamlines our process. Before CliniSync, what we had to do was whenever we had a patient that came in that needed referral services, there was paperwork that had to be filled out. We would take the paperwork, we would fax it to the organization that we were making the referral to. They would call us back, ask us questions. There would be constant back and forth until finally the services were provided, and then a report would be generated, sent back to us, and we uploaded it into our EMR system. Now what happens is we go completely electronic. We log into the CliniSync system and we upload the referral. If there's any documents, we create PDFs from our EMR system, upload those documents as well. And there's hardly any questions from the referring organization. And then they send us information as to when the appointment is going to be made for that particular patient. And then we get the referral report from them. Now, we aren't getting anything back electronically. So what we have to do is if a report is generated, we get a PDF and we upload that. It'd be nice if there would be a totally closed loop where we get the electronic referral back or the report back through CliniSync.
Now that functionality is available, that the entity who received the referral could attach the file. It's just their workflow right now is not to do so.
Right. Okay. And the next question?
Yeah. If you had an ideal world and you had your free clinic, who would you be communicating with?
Well, right now we're sending out referrals to organizations that we work with. It would be nice in the next step to be able to receive referrals from social service agencies. So there's a lot of agencies up in the Northland area of the city of Columbus that call us and send patients to us for through the referrals, but it would be nice to be able to get those, and we would be able to make appointments and see the patients in a timely fashion. A lot of the organizations know about us, but they don't have our schedule and all of that. Well, all of that is available through CliniSync right now.
And I think that with the referral tool that John was talking about, that's going to be upgraded, I think in the fourth quarter, right, Karen?
Yeah.
We will now be able to parse out clinical data so that when you send the referral to a non-HIPAA compliant agency, they won't get all the clinical data. They'll get the demographic. And I think once we break down those barriers, I'm hoping anyway,
Yes,
that then we will have this bi-directional exchange occurring more often.
Yeah, so that would open it up to those non-covered entities like Meals on Wheels and other faith-based and social programs. And I mean, it really just opens the doors to really closing the full loop of patient care.
It definitely does. And John, I think we have at least, 15 organizations that are raring to go as soon as that upgrade is taken. So definitely a lot of interest from that group. So we're definitely very excited about that.
We did have one more question roll in. It's, is the referral service something that can be counted as meaningful use in our EMR dashboard? Now, technically, the referrals are sent in a secure manner. It is our opinion that this would meet the meaningful use requirements. The downside with this referral tool is there are no integration points currently with EHR. So it's kind of it's an application that lives outside of your EHR. There's also no really good way to handle the reporting features that you would need for meaningful use. So there would be some narrative, some documentation that you would have to manually track and be very descriptive in a narrative that you would retain in your book of evidence should you ever be able to, or should you be selected for a meaningful use audit. So it's kind of, yes, you can, but if you're meeting the electronic transition of care referral measure within your EHR, I probably would exclude this tool from those calculations though not discontinue the use of the tool in practice. And I hope that answers your question. Terry, if you need some more information, feel free to contact me after the webinar. That's it.
Yes, Scott, is there any way you can just show us our website? Because I wanted them to understand where to go
Absolutely.
if they're interested in anything. And we may have confused you today by giving you so much information, but I just wanted to show you, if you look at sign up for services right there, that will take you to me. It doesn't look like me, but it is me. You're going to sign up there, and I'm going to assign you to the correct regional person who is your outreach manager and can help. So if you feel a little confused, this is not committing you to any sign up for services. There's an agreement and everything else that has to be signed. And of course, literally, most of these services are all free. So it's not of no cost to you to inquire and find out.
And absolutely. And that way you can get some more materials to think about it and perhaps share it internally.
Great. I just want to thank everybody today, Scott and Steve from the Wellness Center, and John from the Collaborative, and Karen from our staff, and Kathy Rich, who's behind the scenes, and Kathy Costello, who make everything work here for our webinar series. Again, thank you so much.
And with that, we'll end today's webinar. And again, if you have questions, feel free to contact any of the folks on this slide.